The general trend going for us for about 3 years was a stagnant to a slight decline in ER visits.
We had a great deal of dissatisfaction amongst the part of our medical staff.
It turned into not such a wonderful model.
There was a lot of issues with the emergency department.
We felt that we were failing our community with the pre-existing model.
Previous to EMP, I spent a lot of my mornings following up with complaints. The culture was very tenuous all the time.
It became very obvious to us that we needed to do something different. Sharon Regional Health System is a 240-bed independent community provider of services. We have one acute care hospital. We try to bring as many comprehensive services to our community as we possibly can.
Our organization is looking to grow market share, grow services that we offer in the institution, clinically and service-wise.
We had reached out to EMP simply from the standpoint that the emergency care providers that we had contracted with the health system were not meeting our expectations or our patients.
EMP has a set of protocols and evidence-based practice that allow the physicians to be far more efficient, and it takes away a lot of the headaches.
Physicians are happier, nursing staff is happier, and also our doctors and administrators in the hospital are happier.
We've had far fewer complaints about poor care, poor decision making. There's a much more collaborative look and feel to how we provide services.
The corporate office team has been only too willing to come on site, to talk to us over the phone, anything to meet the needs of the health system.
Their mind is in it, their pocketbook's in it, but their heart's in it too.
Nursing has actually come forward to thank the administrative team for the changes.
The volume growth that we have seen in the last 9 months as it relates to EMP being on board with us is significant growth in both outpatient ER visits and inpatient admissions coming through the ED.
A prominent community leader who's also a board member stopped me and wanted to tell me about his experience, which was that his older parent been to the emergency care center several times over the past few months, and how pleased he was with the difference.
I go down to the emergency room, everybody's happy. And you know that transfers to the patients when they come through the door. I don't think I've ever been in an emergency room that everyone was happy. And it really doesn't matter whether every single treatment room is full or not. They're still very happy and they love their job.
The communication's better than it's ever been now. It's seamless. It's never really a problem. I can count on patients that come through here having been worked up thoroughly. I can get a good story as far as what's going on, so I can make my decision, decide if I need to come in, if I don't need to come in, how I need to deal with it, and who I need to call. I haven't had any problems with that since I got here.
They understand that their success is truly dependent on our success.